Okay, good morning, or good afternoon, it still feels like morning on this rainy day, but it's afternoon. Good afternoon, and thank you for attending the Davis Senior Commission. I'm Marcia Coupe, I am the chair. We have here Thomas Rose, we have Elizabeth, I never say your surname properly. Pastrell, okay, excellent. We have Clark, who will be giving us a special presentation from Yellow Cares. We have Maria Muchisi, who is our liaison with the City of Davis. And we have Janet Cheney, who is our Community Services Manager. Okay, so I'm going to move on to item number 2 on our agenda, approval of the agenda. Do I have a motion to approve the agenda?
I make that motion.
I'll second.
Excellent. Agenda approved, thank you very much for that. Item number 3, we have brief announcements from staff, commissioners, and council liaisons. Do we have any announcements?
You guys first. Any announcements? I'll just note that we have a couple upcoming events. This Thursday, we have the Oktoberfest, which is a celebration using the newer patio area at the senior center. It's a fundraiser. It's being sponsored by the Sunset Rotary, who paid for all of the food, which is wonderful. The following day, we have a Mocktails and Menopause talk, which will be a lot of fun, and that will, that's also being sponsored, and I think we'll have between 15 and 30 guests for that event on Friday, so.
Excellent, Maria. Do we want to talk about our agenda for November, moving into the?
I have that
Oh, at
as
the
the
end.
upcoming agenda topics.
Okay, fantastic, okay. Any more announcements?
No, I was curious about the Oktoberfest. What's the timing on that?
5 to 7.
5 to 7.
And is that on the patio?
Yes, it is. Well, I mean, if it really is rain and super cool, then we'll move it to very cold weather, then we'll move it into Valente. But it was a patio party, was how it was delivered, so we'll see. Yeah.
I hope it is a patio
Me
party.
too, yeah.
I want to go, but I want to be outside.
That's the plan.
Yeah, okay,
Yeah.
fantastic.
Yeah.
I'll get my tickets today.
Oh,
Or we're
excellent.
still selling tickets?
Yeah,
Okay, excellent. And then you also mentioned being at, the Rancho Yolo Health Fair?
yeah, so so the same day as the Oktoberfest, we were sent an invitation several months ago from Elizabeth Lazinski, inviting the senior center, but also transit, I think Davis Community Transit as well, Jennifer D'Onofrio, so I don't know what other city departments or divisions are involved, but I know that I'll be there representing the senior center and the commission as well. So in fact, if you want to be at my table with,
I might should.
please, that would be wonderful. It's from 3 to 5.
We should try to find a couple more members for our commission.
Yes,
And that's a good place to do it.
yeah,
Okay.
good recruitment opportunity.
Okay, yeah, I will come.
Okay, thank you.
Yeah, I didn't even see it on our calendar though for this.
Well, no, because it's Rancho Yolo.
No, but I'm at Rancho Yolo, because Rancho Yolo
Oh.
also has a calendar
Oh,
where
I
I
don't
live.
know. Yeah,
So, yeah, I'll
Oh.
double check with Elizabeth, she used to be on the senior commission.
correct.
Yeah.
Yeah, that's kind of where this connection began, where we were
Right.
trying to, kind of cross market
Is
and
this
stuff.
our person?
Yeah.
Is this one of our?
Yeah, it's a good idea.
Director
We're
Dressage.
from Yellow Cares.
Yeah.
Oh, I'm sorry, someone at the door.
Hello, Craig.
This is our the director of Yellow Cares.
No.
It's very nice to see you, Craig.
You
Marcia
too.
Coupe.
Yep, you met Clark, right?
Yes, we
Yeah.
sure did. We sure did. Right, so this is Craig. He runs the entire Yellow Carriage. You've been here for a long time.
Well, I'm in my 12th year.
Yeah, 12th year.
Yep.
I read your essays occasionally in the Davis Enterprise.
Oh, thank you.
And also, I think in your newsletter and your website,
Yeah.
you're a very good writer,
Yeah,
good
thank
storyteller.
Thank you.
Very good storyteller. All begins and ends with a
I
story,
had an Irish
doesn't it?
grandmother, so, I
Oh,
can write naturally.
no wonder.
Thank
Well,
you for hosting.
Yeah.
Yes, thank you for hosting us
Yep.
here today. We're
Happy
still
to.
expecting 2 more members of our commission,
Okay.
but we're rolling along so that we can
Great.
get to the presentation and learn more about you guys. And
Great,
so thank you so much for joining us.
absolutely.
So you've met Maria, she's our liaison with the city of Davis, and really keeps us everything together for the senior
Yeah.
commission. You know me, you and I have talked on the phone a few times and had some email, Marcia Coupe.
Right,
And then, of course, Thomas Roast, who is also on our commission, and Liz, who is also a longtime member and also works for Agency for an Aging.
oh, okay, great.
And this is my supervisor, Janet Cheney. She's the
sorry.
Program manager. No, that's okay, because I had it, yeah. And so, she's here as part of the team.
Thank you so much.
Yeah.
Okay, excellent. Okay, public comment time. The public comment section is for the commission to receive comments, except for brief questions for clarification. No discussion or action may be taken on any item that is not listed on the agenda. Do we have any public comments? Okay, it's gonna be very quick warm-up. Maria, do we have any written public comments?
No.
Okay. Okay, item 5, yellow cares. We are ready for our presentation, gentlemen.
Maybe. Okay, excellent. Well, thank you so much for the opportunity to be here. And there we go. Again, my name is Clark Wright. I'm the Director of Business Development for Yellow Cares. And I'm here in place of Louise, so I'll try and do the big shoes to fill. I hope I can do it justice. And she gives this presentation much better, but I'll try my best. And also we'd like to welcome Craig. Have us here. We just met as well. Is there anything you'd like to say to start off?
Just thank you for being here. I think you know we've been around for just about 50 years. We were the first hospice established in the Sacramento Valley. We're now much more than hospice. Clark's probably gonna talk about that. So, this facility, have most of you been here before, or no?
I have many times.
Okay, so this particular facility, this end of the building, the adult day program, was a collaboration between us and Citizens Who Care, which they were around longer than we were. And the board chair came to us one year and said they had to raise their entire operating support. There was no fee for service for anything they did, and she said, would you guys do a fundraiser with us and split the proceeds? So we did that. One successful, and then the next year they came and said, we'd like to merge into YOLO Cares, because this is just too hard going with no planned or regular revenue stream. And some of the work we do seems to parallel, and they had $250,000 seed money to create an adult day program, and we said, we have the space. So we raised another 1.5 million I was amazed at how expensive it is to retrofit a building. I was like, the building's here, for God's sake, why is it costing so much money? But it does. And so you'll get a tour of this in the therapy garden a little later on, so that's all.
Perfect, excellent. We'll jump right into it, and if there'll be time for the end for questions, but please wanted to make this interactive, and if you have a question, please don't wait till the end to ask a question. So, YOLO Care is an independent, community-based nonprofit healthcare agency caring for those people with life-limiting illnesses. But as Craig's mentioned, we do a lot of community-based projects, and we'll dive into a lot of those things as we kind of talk about that. So, in general, hospice, palliative care, adult day program, which is where we're here now. Galileo Place is our adult day program. We added Joshua's House, with the homeless shelter for the terminally ill patients that's in Sacramento, just off of Northgate in Sacramento. So you're headed about a mile off the freeway there. And we currently, I believe we have 3 patients there, if I'm not mistaken, that are unhoused in this. So it's filling its purpose, and the team has really done an excellent job in getting that going. And Craig's work with getting the funding, the community to come together. And great to have that in place. Resources for caregivers, we do a lot of training and support. Training here, I do training out in the field where we talk with caregivers and facilities and help them up their skills when it comes to taking care of patients. Volunteer-led respite and socialization, grief support, counseling. Craig mentioned that a little bit with the Citizens Who Care. And that's part of that, and then community education outreach, which is what Louise and I do, a big part of our work here. And so we kind of just wanted to share this slide. This slide I think is very important because our main purpose in what we do here supports hospice, but it's a big continuum, right? And so as we go and speak with people and share with people, we all start our lives as babies, and mostly we're healthy and we're moving along, we're growing into our world. And at some point, we start to recognize that we can't eat the things we used to eat, or we can't do the things we used to do. We try to prevent illness because maybe we're getting older. This maybe after we're getting older, things are happening, and we start to prevent stuff, vitamins and things that we're doing. But then some point online there comes an illness, a significance. So I like to, as I share this, I'll share my mom's example for my mom's experience, for example. So my mom, healthy woman, but she found she had bowel cancer about 4 years ago. And so she decided that she's kind of in this, so we entered this phase here, right? So now we're like, okay, we have this cancer, now what can we do? Mostly curative, okay, what do we do? So the first thing was, let's do surgery. So we got on into surgery, and we removed the cancer, which was fantastic, but then a year later it came back. Okay, and so the curative, and now we're doing kind of a little bit of both curative, symptom management. What can we do? What's the next step? She had a brother who didn't want to have chemo, and she watched him live through chemo, and she said, I'm not going to do that. I will not do that. But I will, so that's off the table. Okay? But I will do radiation. So part of that symptom management treatment was to do radiation. So it spread to her lungs, targeted radiation to her lungs. And then she also was doing tons of holistic things, and she did everything. Apricot seeds, all kinds of different foods or homeopathic things to help remedy that. And we thought we were doing well and things were good. Her scans showed that her lungs had, the cancer hadn't grown, they've actually shrunk. But then we had a big reunion with our family, and all of a sudden something was different about Mom, and she just seemed to be a little bit more cognitively declined. And we found that it's now in her brain. So now she has stage 4 brain cancer, right? And so as we try to do curative and symptom management, and she said, you know what, I'm not gonna have surgery on my brain. It's too risky, the risk was reward for us for that. Didn't seem like it was possible or would make sense. And but we got her onto palliative care, which we'll talk about. It's a service that we also provide. And she's going through that, and we found brain cancer. We turned out that we needed to do more symptom management because our curative treatments are no longer, we've made decisions that have taken us down a road that will only let us have certain options. And so right now it's symptom management and radiation, and she was admitted to hospice a few weeks ago. And if you see her, you wouldn't think anything about it. She's great, but she does have some cognitive decline because of the brain tumor. And so all those things that we talked about, curative, symptom management, hospice, end of life, bereavement, that's all kind of under the umbrella of palliative care. And so when you think of palliative care, just think about all those kind of groups, okay? We're still trying, in some cases we're still trying to cure, we're managing symptoms. Hospice is part of palliative care. All hospice is palliative care, but not all palliative care is hospice.
Oh, excuse me one second.
Yeah, of course.
One of our commissioners is
Yeah,
arriving.
should I wait? I'll hold.
Oh, thank you.
Yeah, of course.
Is your mom having hospice care here?
She's not,
With
so I'm
mobile
from,
care?
I'm from Utah.
Oh, right.
And so she's in Utah, but she is with a nonprofit, CNS, that works with the Huntsman Cancer Institute in Salt Lake. And so she's been having a lot of treatment through Huntsman, and so the hospice is there then is.
I'm really very happy to hear that they even have hospice there.
Yeah, there are lots.
That's wonderful.
There's lots of hospice. Welcome, how are you?
Yes, it's gonna be a tight
Well, let
squeeze.
me help you.
So this is one of our commissioners. This is Carol.
Carol, nice to have you.
Thank you. Okay.
If it's easier, you can sit over here on the
Yeah,
couch.
please.
Yeah.
Right here or over here.
Yep.
I'm gonna sit over here.
Yeah.
Yes, please do.
This is Jeffrey, also on our commission.
Hi, Jeffrey. How are you?
Okay.
Thank you for being here.
Hey, Jeffrey, you can come in here.
You wanna come in here?
Brave.
Fine.
Jeffrey.
Gabby's over here. Right.
Perfect.
Apologies for the
No, that's
disruption.
not, absolutely. We're here for you. It's totally okay. Can you see the screen if I'm behind you here?
Ms. Gavin, if you'd like.
Okay.
Did anybody not get one of these yet? Bad news.
Okay, well, we're having a presentation right now, Jeffrey, so we're gonna
Totally good.
continue with our presentation. Thank you.
Wonderful, thank you. And so this is kind of the scope of palliative care and the things that we do, and so we'll jump in a little bit more. Any questions about this in general? Pretty self-explanatory.
End-of-life care.
Yeah,
Is that if you have a diagnosis of 6 months or less?
that's part of it, yes, hospice, yes. You on to hospice if you have a diagnosis in 6 months or less, that's correct.
And then you can get palliative care?
Yes, palliative care typically is kind of, we look at it as maybe like a 2-year process, so towards maybe the end of life. So they're still doing curative or still doing symptom management, but end of life is not looming or.
So we're a safety net provider, which means palliative care is available to people in the communities we serve, largely without reimbursement. We do get reimbursed for a small portion of our palliative care patients because they have insurance that covers that. Medicare and Medicaid, or Medicare, yeah, and
Medi-Cal.
Medicaid outside of California don't cover a hospice or a palliative care benefit.
Medicare and Medi-Cal do?
Medi-Cal does. You have to have a contract with their payers, like Partnership Health, which we do. So out of 90 palliative care patients we have on service today, we're getting reimbursed for about 10 of them. And the other ones, and this has always been the case, we provide free of charge. We don't bill the family or the patient because this type of community-based palliative care is not available through the health systems. And it really keeps people as much as possible out of harm's way and out of going to the emergency room repeatedly or hospital stays. We try to manage people in their homes where they're at so that they don't feel like they have to keep going back to the hospital.
Well, you know, California is a right to die state. So
Right.
if you have less than 6 months,
Right, the end-of-life option.
end of
One
life.
thing I was gonna suggest is maybe we'll let the presentation happen in its entirety and then come back to questions afterwards.
Sorry.
Yeah.
Thank you. All right, so we'll jump in a little bit. What is hospice care? Hospice care is right for people at the end of their lives, and when treatment of their illness is no longer an option. As we talked about, focusing on symptom management, comfort and quality, visits from licensed clinicians, and emotional support for patients and families. How do we provide that? We provide that wherever the patient is, wherever they call home. That's where we'll go and do that. At their home, or at the Joshua's house, the shelter, an assisted living, a skilled nursing facility, a care home, any of those places. What does it include? Of course, medical support. So we're now changing our focus from curative to providing comfort. So managing symptoms instead of trying to cure the disease. Management of pain and symptoms is our top priority, and we'll help provide some supplies. DME, we call it durable medical equipment, beds, briefs, walkers, oxygen, etc. And of course, some increased support as a health condition progresses. As we make those visits, our team is really, we meet every 2 weeks as a team. It's called our interdisciplinary council team, right? We'll have our doctor there, our nurse there, social worker, chaplain. They all kind of talk about the patient every 2 weeks. And they discuss changes in plan of care and how they can move forward to help out. We do take care of emotional and spiritual support. We have our chaplains and spiritual care counselors. We have some death doulas that we work with that are over at Joshua's house as well. And then support from grief counselors for patients and families. Many times we'll have children that come to our office that are receiving counseling in-house in person, which is great to see. Support for the family members, we talked about that. It's 24/7. Nursing support, if you call us, there's someone to answer your phone call to help triage what may be needing, and we're there to help. Bereavement, grief support before, during, and after death. So who should receive it, right? I mean, it's kind of a tough subject. The word hospice can have some negative connotations and maybe scary to some people. We talked a little bit about those that are terminally ill, of course, no longer can be treated to cure their disease and have a life expectancy of 6 months or less. And typically the doctors refer those patients, and we work with them to try to be as proactive as possible because the sooner they can get the benefit, it's been proven that hospice care can actually help prolong someone's life, take care of them.
In fact, we're required under law, if a patient starts to get better, we have to discharge them from hospice.
That's correct.
And then they come into our palliative care program. But we have many patients who start to get better because they're getting the whole person care they could have benefited from before.
Yeah,
And we've also had patients on hospice for 2 years,
yeah.
who continue to just decline slightly, but they're able to stay on hospice for that long.
Yeah, even more. We're running a project now that's doing some research on our patient population and what's happening. And we came across a patient that was admitted in 2018, passed away in 2013, so almost 5 years. And so it can be, they say 6 months or less, but as the patient continues to decline, weight loss, lack of eating, cognitive decline, that's that part of that 2-week intervention or meeting where we all talk about it. And then also every 60 days, the doctor will do a face-to-face to make sure, yes, this patient is continuing to decline. As Craig mentioned, we can't bill Medicare if they're doing better and have to be discharged off service. So there's a big process when it comes to that. Just real quickly, I won't get too much into this, but many payer sources, right? Medicare as the primary payer, Part A, Part B, C, and D. Also private insurances, we accept many. Here at Yolo Cares is a nonprofit. We really promote that insurance, no insurance, will never say no to anyone. And I think in the 12 years that we've been here, we've never declined a patient for
No.
care.
We've never built a family.
For insurance. Or build a family. So the donations and the philanthropy that happens here and the grant work that our team does helps to pay those as it's needed. So it's a little bit small here, but basically we have the family we have the family and the team that surrounds them. So we have the physician, the nurses, the home health aide, spiritual care, social worker, volunteer, all placing the family and the patient at the center and working to help them within their scope of influence. So that team, the interdisciplinary team, the physician, RN we talked about, every hospice needs that MD to make and refer patients, oversees all the plan of care and the prognosis. The RN, in conjunction with the team, develops that plan of care, teaching caregiver skills to the family based off the diagnosis. Your mom has a brain tumor, this is what we can do. Your family has Alzheimer's, this is what the plan of care would look like. And then also working with the family to build that plan of care. Usually 2 to 3 weeks, 2 to 3 times a week for the nurse visits. And depending on the visit, they last, anywhere, 45 minutes to an hour, maybe more depending on what's needed. And then again, they're on call 24/7. Social worker, counseling, emotional support. A lot of times we'll have patients that we find in a unhealthy or unsafe living condition. And so our social workers will work with them to find a better, safer place to live. Financial, legal resources, insurance. Our spiritual care providers talk about spirituality, concerns or issues or questions, and meet them where they're at. Of course, we're not here to change anyone's perspective in mind when it comes to spiritual matters, but to identify what their beliefs are and to meet them where they are and help support them. All right, our home health aide, assistant personal care, activities of daily living, bathing, changing, light housekeeping. We have a very robust volunteer program that helps support families, respite care, companionship, transportation, whatever the team. We try to match our volunteers to the needs of the patient and the family, and we have a great volunteer program. Bereavement counselors, so support groups, one-on-one counseling, we have Zoom counseling, we have in-person groups that are here. We have our Stepping Stones Children Bereavement Program, and then services provided 13 months after death of a loved one. So hospice, of course, is for the patient, but also for the family. And so we're navigating that, but it continues, the benefit continues after the patient's passed away to be there for the family. All right, I'm gonna switch gears a little bit here, and then we'll talk about palliative care. So palliative care, we're focused on symptom management, and palliative care is just the broad term for comfort care. And every agency, different companies, how they utilize palliative care, how they execute palliative care. There's not necessarily strict regulations on how it is done. Everyone can kind of choose how they do it. We've chosen to be joint commissioned, so our hospice is joint commissioned, which is the gold star for hospice, and same and also for our palliative care. So very high standard of quality and compliance geared around safety for patient and family. And so that's something that we really feel good about, that we're really trying to give the highest level that we can. Help them to feel better, provide comfortable life. Again, the palliative care team is still going to address emotional, social, practical, and spiritual problems that can come up. But again, it's just still a focus on symptom management, but also curative care in partnership with their current doctor. So The doctor, all the meds, pain management goes through the doctor, but our team is there to help support and navigate with the family. Push your seatbelt care. So again, chronic illnesses, cancer, heart disease, lung disease, kidney failure, dementia, HIV/AIDS, ALS. Anyone that has a life-limiting illness, but again, not necessarily 6 months or less, they would be on hospice in that case, but this is there to support them during that time. So we provide clinical case management, symptom management, visits from licensed clinicians and social workers. In some cases, the nurse can go with the family to the doctor's office to kind of navigate that. If the family is overwhelmed or needs help with that, they can talk the lingo with the doctor in the doctor's office if needed. That's a resource. Connections to resources, social and emotional support from counselors or chaplains. Palliative care is variable. The care a patient receives will align with their personal health care goals and the progression of their illness. So just like every person is unique and individual, their plan of care will be unique and specific and tailored to them. When's the right time for increased care? A lot of times we find that as I mentioned, we're doing this project, we're kind of seeing how long patients are staying with us. And they range from 5 years to 1 or 2 days, right? And so obviously here we want to make sure that people have the right opportunity to receive that care and receive hospice or palliative care as soon as possible as they need it. And so as we kind of look for those milestones or partner with communities and doctors to help our patients receive care earlier in the diagnosis. A lot of times doctors want to be there, they want to cure, and sometimes hard to let go of that, have the conversation, so we try to partner with them to have that conversation.
And I would just say what we found is there are many doctors who call us because they want our nurse to have the conversation with the family and patient, because they don't want to have it. And we're very well seasoned in having those conversations in just the right way. So a lot of times doctors will rely on us to get involved at that level.
All right, how do we pay for palliative care? Free, it's free. You don't have to pay for it. So we're able to provide that again through the donations, and when we can bill, we will, based off of the plan of care and the insurance, but for the most part, it's free for our patients. It'll include the in-home visits, right, psychosocial support, care planning coordination, volunteer support programs, and the adult day program, which are here with us today. And this is the family room, and I think all of you mentioned as you came in here, I was just listening, what a beautiful room set up, the way that it's just a great inviting place. All right, we kind of touched on this. We'll go into a little bit more of the differences between palliative care and hospice. So all hospice is palliative care, but not all palliative care is hospice. They're both focused on symptom management. Palliative care begins at diagnosis and at the same time as treatment. Hospice care begins after the treatment of disease is stopped and when it's clear the person is not going to survive the illness. So in the case of my mom, we stopped, we're doing surgery, the radiation wasn't working, spread to her brain. There's really not much else that we can do, just try to keep her comfortable. And at that point, she moved to hospice care. How can we refer a patient? Anyone. You're all familiar with our now you've been here, you know where to come, and our phone number is published. You can give us a call. We'd love to help take care of anyone that's in your scope of influence. All right, our phone number is there. You have that. We'll make sure you have information that you need. All right, let's transition to this wonderful place here, Galileo's Adult Day Program. Fully licensed adult day program provides respite care for caregivers. Open Monday through Friday, 9 to 5, staffed by trained professionals, and ideal for adults with limited mobility and or cognitive impairment. So right now they're playing games, they're having lunch soon if it's already over. We partner with Meals on Wheels to bring food into the residents here, the participants, and so a great opportunity for them to be here. We touched on Joshua's House, home for terminally ill and house and sheltered patients. Referrals through partnership and other major health systems. We've been around to pretty much all of the systems in some capacity through announcement or email. In person, we met with Sutter's been our best partner. We're able to go in place in person to Sutter Roseville, Sutter Davis, Sutter Sacramento. We have a great relationship with Sutter, and they help donate a lot of philanthropy to us as well. So. And
we were planning on doing this Joshua's House project in this building too, because we own the building and the space in the center is leased out to UC Davis. And during the pandemic, it looked like they were gonna be exiting the lease. And we applied for, under the Biden administration, the American Recovery Funds. We applied for a grant, sat in on many sessions with the city of Davis and the county, hoping, because we asked for some of the money from Davis and some from the county. I think between the two entities, they got around $40 million from the federal government for projects like this. But we, after 18 months, we had to take our proposal off the table because it didn't look like there was clarity on what was gonna be funded. And then UC Davis told us that they wanted to re-sign a lease. So we couldn't keep them in limbo for too long. But originally, we were hoping to do this project here on our campus in Davis. Yeah.
It's a beautiful place. There's multiple cottages like you see here. And we currently have, I believe, 3 cottages open with plans to open more as we progress and able to develop the program. Delivered with dignity, compassion, and grace. First of its kind on the West Coast, which is very exciting for YOLO Cares and also for our community. And it's a model of community-based, patient-centered, values-driven care. All right, so located in South Natomas, 15 patients at a time in a warm and welcoming home setting. We started off by just having 1 patient, then 2, and just kind of growing into it to make sure we identify the process. The first time this has happened for the city, for us, for everyone, make sure that we could work it out. And so our goal is to get to 15 patients, and there's space there for even more building or beds. We're still going through that process. So. Trauma-informed end-of-life care and support reflecting personal values, goals, and needs. We provide the care. A Joint Commission created an agency, as I mentioned, or by one of the insurance health system partners. They are also able to provide care if there's an arrangement agreement for that. All right, Craig talked about this, this is something else. The Center for Caregiver Support, resources for caregivers of those living with life-limiting illnesses, workshops, respite programs, social and emotional support. We really strive to be a support not only to the patient and resident, but to their families.
And just to mention about that, we've been successful in getting grants to cover the cost of a caregiver. So if you're caregiving for somebody at home and you need a retreat yourself and to hang out with other caregivers, we have those retreats here at this facility. They offer emotional support, connection with other people who are going through the same journey you are. Parts of it are like a spa day for the caregivers to take care of themselves. And then while the caregiver is here, the grant pays for a professional caregiver to go into your home while you are here so your loved one is cared for, so you don't have to worry.
Amazing opportunity for families to come get some training, but also some respite. Citizens Who Care volunteer program. They are specially trained to support patients and families, members at the end of life, in-home respite visits, socialization, support with pet care as needed. Center for Loss and Hope. It's a free community resource for those managing grief. For all community members, supporting groups. We did, when they had the tragedy here, the stabbings here at Davis, UC Davis, they called on us and our team to go in there and help to do some counseling there and support for those students. So really all aspects and needs of the facility, or the community. Support groups, one-on-one counseling, YOLO Cares for Kids, 13 months of bereavement support post-death. We've also participated in something called the Life Transitions Project. Showed the Yoshidahi Winton Nation. They gifted YOLO Cares a $1 million grant to research and address barriers to end-of-life care within rural and Native American communities within our 5-county service area. And through that project, we're working to deconstruct obstacles to ensure equal access to end-of-life care for all. Okay, you can kind of see here over to the right the kind of the breakdown of the ethnicities in this area, and a lot of work we can do to help support everyone. So always trying to improve and do better there. All right, this is how you refer to us as well, and this is the last slide. Thank you for your time. I didn't keep you past 30 minutes, so it was good.
Thank you.
And any questions that you have that we can address and that Craig can answer for you as well.
Yes, you had mentioned that you have a really robust volunteer group. And I was curious, how many approximately volunteers do you have?
I think we have between 80 and 90 volunteers. Medicare requires hospices that are Medicare certified to have patient care volunteer hours that equal at least 5% of your paid clinical staff hours. It's a requirement, although they don't enforce it with a lot of hospices. We, this past month, we're at almost 13%. So we exceed that quite a bit every month because of just the nature of our volunteers. Frequently, our volunteers are former patient family members.
Right.
We took care of somebody in their family and they want to give back. So they go through our volunteer training and, yep,
That's what I did in England,
Yeah.
exactly identical that, yeah.
yep,
Yeah, once you experience it, then you want to
Right.
be a part of it, pass it on.
absolutely.
Yeah, excellent.
Yeah,
That's really impressive, Craig,
yeah,
really impressive.
yeah.
Yeah, if your diagnosis is less than 6 months and you live alone and all of your relatives are deceased, do you do in-home palliative care or?
We do in-home, but we will try to figure out how to get more caregiver support in the home if there's no one else there with you. Yep.
Yeah.
Now, private caregivers coming into the home, that is, we don't cover that cost. Our staff is there, our volunteers can be there, but if you need somebody in the house 24/7, we help you get linked up to those services.
I have partnership, does that cover?
Yeah, I'm not sure exactly what partnership, but there is a benefit with partnership health
There is,
for
yeah.
in-home caregiving.
It's
Yeah.
Medi-Cal.
Yeah, yeah,
A lot of resources in the community for that, absolutely.
yeah.
Great questions. Any other questions?
I have to admit my ignorance, I didn't even know this program existed. And I'm new to the commission, so they'll know a lot more about this than I do. I'm quite impressed by your presentation and wonder if you could share it with us.
Absolutely, yeah, I'll send the link to you.
Maybe send it to Marcia and she can share it with the rest of us.
Absolutely, yeah, feel free to share it with them.
So let's say that I have a loved one who needs this kind of care and I don't know anything about this. What's the process? What are the steps
Yeah,
to get somebody involved with this?
we could start by talking about them right now and to ask questions. That'd be the first step too. You're welcome to call us, we can schedule an appointment another time. And just really get to know, understand what your needs are and the needs of your family or relative. And then start to kind of build that plan of care and what that would look like, so.
It's really easy, you just call us and say, I think my loved one needs hospice care. And our intake department will ask a bunch of questions, but they'll schedule a nurse and a social worker to go out and see your loved one. And they do an assessment from that visit, and then they'll get the medical records from their physician and whatnot. So that'll start the whole ball rolling.
Right, so I've lived in Davis more than 50 years and didn't know about this place.
Wow.
So am I unusual, or does the community really know about this place?
Well, I don't know if the committee does. So did you know Tom Frankel?
No.
Oh, you didn't know Tom Frankel? Tom was an attorney in Davis for 50 years. He was our board president for 3 different terms. He just died this past summer, but, yeah, I'm surprised you haven't heard about us.
Do you know
So
anyone
glad you were now.
on the Davis News? Any, like, you bring up a good point, right? There's a lot of, it's been here a long time, and we make sure we get the word out. We do that through meetings like this. We do a lot of community outreach to different fairs in the community. I have a team of 3 people that are out in the hospitals and skilled nursing, assisted living, and sharing the message there too. But to your point, there's always an opportunity to improve that, and we'd love to, by sharing this with you today, I hope you can also become ambassadors for us.
Yeah.
And point people our way through your scope of influence.
If you could share the presentation, I would share it with people I know too.
Of course,
who
absolutely, I'll do
don't
that.
know about this place.
Of course, yeah.
You know, people like us, I mean, I moved here a couple of years ago from 20 years in England, and my daughter and her family have been here for 30 years, and I drove them back here one day just really excited to show them, Yolo Cares. We didn't go in or anything, we just where it is and tell them all about it, just because of my experience with hospice in England. And so my daughter and her family never knew it existed as well, even though I do feel that you, Craig, do an excellent job with the media and consistently, writing your stories and sharing, your experiences with us. So I applaud you. But people read different medias now. Media is so disjointed now.
Yeah.
It is so disjointed that it's really hard to nail it down with one or two of the best places to be. But I think people like us spreading the word, and really being advocates for hospice is super important, especially given you're one of the very, very few nonprofit hospices now in a land that has just, picked it up in the rapaciousness of the corporate world of America and turned it into another money-making enterprise. So, I hugely applaud that you've stayed nonprofit. You've stayed true to your roots and to the roots of hospice, which is really rare in America. Very, very
Well, we
rare.
grew out of so hospice care grew out of the civil rights movement in this country back in the late 60s and 70s. We are an outgrowth of the civil rights movement. People did not have a choice or a say about where or how they would die. So from coast to coast, community groups got together and said, this isn't right. In fact, one of our founding physicians here in Davis, Dr. Jack Berger, tells a story about being at the physician's lounge up at Woodland Hospital, scratching their heads back in the 70s, frustrated because Mrs. Smith, who they took care of for 30 years, they knew her family, they watched her kids graduate from high school, she's now at the end of life, and the only thing the hospital system could do at the time was to try to cure, treat. And the doctors saw that these procedures were actually shortening her life and robbing her of any quality of life, and not aligning her goals, by the way. What are your personal values, and how can we align your care with that? And so a small group of physicians and community members from Yolo County got together and they said, to hell with the healthcare system. We're gonna cobble together our own model of care. And that was the birth of Yolo Cares. That happened all across the country. For the first 20 years, there were only nonprofit hospices. After the Medicare hospice benefit passed, then for-profit companies jumped into the mix. When I moved here, there were only 12 hospice providers in our market. Now there's over 70. And they range from small mom and pop shops trying to build a retirement nest egg, which there's nothing wrong with that. I just personally feel it's the wrong reason to be in this business, to large national chains like Vitas, largest provider in the country. They're owned by Roto-Rooter, so if you need a toilet unplugged and end-of-life care, you can call the same company. They're actually both owned by ChemEd, which is publicly traded on the New York Stock Exchange. So their interest, the reason for existing is entirely different than our reason. But all of that, the reason why your neighbors and your families should choose Yolo Cares if you need that kind of care is because our quality of care is unmatched. We're in the top 1% nationally, in the top 1% in the state of California in terms of measured quality that we publicly report. You can go on Medicare.gov's website and look up our quality scores. And so we would love your help in spreading that word, because not enough people realize that they have the creme de la creme of end-of-life care providers right here in their own backyard.
And we welcome any of the connections that you have. We'd love to speak in small groups or larger groups, the same message. And so if there's a group that you're aware of that think this would be great, please let us know. We can coordinate with them as well.
We're really fortunate. I mean, there's no such thing as for-profit hospice in Great Britain. It does not exist.
Right.
They're in partnership with the National Health Service, but really, they also get most of their money, same as you do, from grants, from donors, from people who hop on board and say, this is where I'm gonna put my money, this is where I'm gonna put my passion.
Right.
So it's a completely, you know, because everything gets corporatized in America, it's a completely different situation, and I am really proud of you guys. Super, super proud. And of Joshua House, are you in a partnership with the city of Sacramento or with the county of Sacramento with Joshua House?
Both the city and county have been hugely instrumental in making that happen.
Oh, wonderful.
The founder of Joshua's House, she's, how old did Marlene turn this year? 80, I think 87. So she started this whole project when she was 80. She was a former director of the Cancer Center at UC Davis. And her grandson, her favorite grandson, died on the streets of Omaha, Nebraska, homeless. And she came back here and she said, that's not gonna happen in my hometown. So this whole Joshua's House project really started with her. I was on her board for 5 years and then stepped off. And she had reps on her board from all of the health systems. And then 6 months after I stepped off the board, she called us up and said, YOLO Cares is the only organization I trust to take this on. Once it's paid for and finished, will you accept ownership and operations? And our board voted that absolutely we would do that. So that's how we ended up with Joshua's House.
Wow. And was her grandson named Joshua?
Yes,
Yeah.
yep,
Good guess, huh?
right, yep,
Well, fantastic.
yeah,
It's a great story.
yeah, yeah.
Any other questions?
Your YOLO Cares, and so your service area is limited to,
We're licensed to go to 10 counties, we operate in 6. So Solano, Yolo, we go up to Sutter, to Yuba.
Sacramento.
Sacramento, of course, parts of Placer County.
But if you have loved ones in other areas of California and you need a good hospice provider, you can just call us and ask us for a referral. That happens all the time. Because we consider the other nonprofits and actually across the country, sister organizations. We do benchmarking together, we work together on a number of fronts, so.
Yeah, great question.
Yep.
You mentioned Sutter being a very good partner for you.
Yeah.
And I happen to think Sutter is a very good organization. I had a big experience with them this summer, which I won't go into, but I was very impressed with them. Do you partner with other big healthcare providers like Kaiser, UC Davis? How are they also in any kind of partnership with you?
We do, you know, it's funny because I describe the health systems as our frenemies.
Yeah.
Because they all have their own hospice programs and they
Yeah.
compete with us. But they also refer to us. So, you know, they all kind of have caps on how many hospice patients they take, especially Kaiser. So when they hit that cap, we're at top of the list for them to call. So, and the health systems have been good partners. I say that in jest that we think of them as frenemies because of the competition piece, but they are nonprofit health systems, and so they have a commitment to this care that other, you know, for-profit players in the market would not necessarily have. And Sutter's been very supportive on Joshua's House. Clark and I have been to Sutter Roseville, Sutter Sacramento, and East Sac, presenting to their discharge planning teams and physicians around how to make referrals into Joshua's House and how all the process works and stuff, so.
Our first patient came from Sutter, Sacramento, at Joshua's house.
Yeah.
And we also have a contract with Kaiser, so Kaiser Commercial, we're one of the few providers that have a contract with them. As Craig mentioned, so UC Davis, Mercy, Dignity, and Kaiser, I don't know the exact number, but it's between 30 and 50 patients is kind of their cap.
Mhm.
And then they divert out, so there's a system that communicates with all providers in the area. And it's family choice. If the family doesn't have a choice, they ask the facility who their preferences are, and so we try to be on everyone's top 3 list, to see, make sure we can be, at least have a seat at the table with them. Sutter is is on a big expansion for their for their hospice program, so they'll be growing. They don't do that. They want to grow and have a bigger system, and that's why it's great for us to be a good partner with them, because they're still, they don't have something like Joshua's House, and so we're happy to fill that need for them. And then they donate to our programs, Camp for Kids, or the,
Yeah, we just had a family
from
camp
Sutter Family Camp.
2 weeks ago in Occidental.
160 people went up to Occidental, and it was largely funded by Sutter.
Mostly low-income families too, so there's no cost for the camp, and for people who have a bigger financial need, they even provide gas cards to be able to afford the gasoline back and
Wow.
forth, so. Yeah,
Huge success.
How
Let's
is
keep
your
it going.
relationship with UC Davis?
it's fine, our relationship with UC Davis is strong. I would say out of all the systems, they tend to work a little more in a vacuum. I wish that wasn't the case. I came from hospice programs in Chicago where we had close collaborative
I'm
relationships
from Chicago.
with Northwestern and University of Chicago. We had a joint fellowship program for physicians to get them certified in the field of hospice and palliative medicine, and UC Davis has a fellowship like that. And I was willing to fund, we were willing to fund one of the fellows. But they're kind of a closed system a little bit. If we need help, they're right there, they're great to work with. But they function a little differently than the other health systems.
We have a big population here, not a big population, but, so we have UC Davis, of course, in Sacramento, but then we also have UC Davis doctor's offices here and a presence here. And a lot of our times the people who live here will go to the cancer center, UC Davis, and then they'll be referred back to YOLO Cares because of where they live here. And so we do get a lot of referrals from the cancer center, and then also the UC Davis palliative and home care services. They're one of our big providers, so we do get.
And I think they tend to keep their hospice programs small, aren't
they
they?
do, yeah. I think they're
Like
like
40?
Yeah, 30 or 40.
They only care for 30 or 40 patients at a time. Like today, we have 140 hospice patients, 135
Yeah.
patients on
In all the
service today.
counties.
In all the counties,
Yeah.
yep, and then another 100 palliative care patients.
So we're 4 times their size, but they have a huge, like, I guess their model is just to divert, they'll do a few,
Right.
and their focus is probably more on curative
Yeah.
and that business there, so. Yeah, but a great partner, both of them, all of them are great. Some are more, we get probably our biggest provider is probably Kaiser, more business from Kaiser than probably anyone else. And then Sutter, then UC Davis, then Dignity, so.
May we ask, what is your annual operating budget?
It's about 15 million.
Okay.
Yep.
And just, without getting too labored about it, how much of it is privately funded? How much of it is any kind of government or grants? Or
So 90% of our funding comes through Medicare and Medicaid.
Okay,
A sliver of it really comes from philanthropic support, but the reason why we do fundraising, so every hospice in a region gets reimbursed the exact same amount from Medicare, which is, here it's about $250 a day for each patient. And what that is supposed to cover is our medical director, our physician, our nurse who sees you several times a week, the nursing aide who comes in to tend to your bathing and personal needs every day, social worker, spiritual care support. And it's supposed to cover all of your prescriptions related to your diagnosis, durable medical equipment like a hospital bed, oxygen, adult briefs. All of that is supposed to be covered with the $250 a day. So the way for-profit companies make that work is they say our nurse case manager, the nurse in charge of a group of patients, she's gonna have to take on a caseload of 28 patients that she's responsible for. We don't do that. We keep our caseloads at 11 to 14 patients per nurse, because we know that translates to a higher quality of care. So the model we have is more expensive than what a more expensive model than you would find in a for-profit company. But we also know that it's required to deliver on quality for care. So a number of things like that really, and we're in the position to raise money to be able to do that. The for-profits can't do fundraising. Yeah.
Thank you.
Yep.
The current budget, federal budgets thing that's all screwed up right now, if that's approved, how do you think that will affect you?
I don't think it'll impact us. Knock on wood, I don't think so. The hospice Medicare benefit is something that lawmakers have really been hands-off about because it works well, and why tinker with it? So, and we're plugged into a national organization called the National Partnership for Hospice Innovation. And members of our team were just at their annual meeting in Washington, D.C. They went on the Hill, they met with lawmakers, both Republicans and Democrats, who are wildly supportive of hospice. And so I think from a policy perspective, lawmakers understand hospice, and they don't want to muddy the waters by making too many changes. So
Hopefully you're right.
hopefully I'm right. Yeah, it's all up for grabs these days, so.
Any more questions?
Well, I have a question. It pertains to fundraising. How do you get, in terms of fundraising, how do you, do you have specific events for fundraising? What is the outreach in terms of your fundraising? Because, there are a group of people, who got extremely wealthy during COVID, and some of them could really use some good publicity. Just off the top of my head, having lived in San Francisco, Mark Benoff, he built UCSF Children's Hospital and Women's Hospital. He gave him $125 million. He persuaded Mark Zuckerberg to rebuild the county hospital. Mark only gave $75 million, but okay, it got built. And so, you would know Benoff as Airbnb. That's him, that's one of his projects. So there are people there who are willing to give and who can give. But one of the things, just different meetings I've been to, it seems to me that's one of the things that's lacking in Yellow County, is the outreach toward philanthropists, people who can maybe pick up the phone. For example, baseball team, the Dodgers, just wrote a check for $100 million. And there are people that have that kind of money who would want to give, and once again, who could use good publicity. But, and I wonder about that, because it seems to me when it comes to networking with people like that, Yellow County is closed. Yellow County is closed. And, but those people are out there. Gotta get yourself invited to one of their soirees, And you'd be surprised. You'd be surprised who's who in Birkenstocks and jeans,
Right. Yeah.
It's true.
But $1 million watch, because that's how they dress in Hollywood. But it's really interesting. But like I said, there are people out there and who would want to give. They understand what you're doing, and I think they would. I've been away from them for a while since I've been up here, you know, but, I know my children went to high school. When they were in high school, we were in San Francisco. And just on when we got there, I think the .com was just about to, you know, tank. But the average bill in San Francisco during .com that was circulating was $100, the average bill, and money was everywhere. And it didn't happen like that with the tech industry. Their money stayed with them, but with the .com, money was everywhere. And people really were giving, and my children were able to do things, and one of them one of my daughters learned how to sell a tall ship, and they took off from the Key West in Florida and sell to Turks and Caicos. And they cut that check for her. Belvedere, that's a millionaire, conservative, low-key. They are rolling in the dough. And one of the persons who said, I'm gonna give your daughter the scholarship is, she said to me, I can see that you are involved with your daughter and she will be fully funded. You know, had the time of her life, and if you looked at, the Girl Scout leader was multi-millionaire. So these people are still there and they still have their money. But it's just a matter of getting out there and meeting these people, or inviting them in to see what you're about and what Yellow's about. Because Sutter built a brand new hospital before I left. And they didn't think they're gonna do a huge hospital on Van Nuys. And people didn't think they were gonna do it because they owned like a couple of them, but they were really old. And so, and this is where I become familiar with them. So these people are out there and they can give and they would wanna give, but you know, you've gotta, you know. wise
Great
people.
points, Carol, excellent points.
Geez.
We're gonna have a tour though, we're on a bit of a time limit, so we still have a tour that you're going to give us and show us the facilities. Thank you so much, Carol, much appreciated. So we're ready for our tour if there are no other questions.
One last item, which is only to determine if the next meeting can happen Wednesday, November 5th at 1 p.m. So our regular date would have been November 11th, which is a holiday. So we would be moving the November meeting up a week, and we do have.
So Wednesday.
Correct.
Wednesday, November 5th.
Oh, I'm sorry, yes, yes, it's moving it up a week and also a
Right,
different
a
day, because
day.
that worked well with the staff, if it also works well with the commission, so.
So, do we have a motion to approve our November meeting be moved to Wednesday, November 5th, given that the 11th is a holiday? Do I have a
I
motion?
second that motion.
Okay,
Okay, Tom and Jeff.
Tom and Jeffrey,
All right,
motion approved.
okay.
Thank you.
And we can adjourn the meeting if you like then.
Oh,
The meeting can be adjourned and we can have a tour.
oh, okay.
Yeah.
Okay, I wasn't clear about,
Yeah,
okay,
sorry about
thank you.
that.
Okay, meeting is adjourned, thank you very much. Let's enjoy the tour.
Thank you. Craig will take you around and show you the different parts of the building. Thank you again for